Hi, my name is Lindsay Connell, and this is my service learning project. The agency that was selected was Freedom Detox Facility in Gastonia, North Carolina. This was of a particular interest of mine as it is the only residential or inpatient detox center for drug and alcohol in the state. I have a lot of experience with drug-related overdoses and deaths in the emergency department as well as the intensive care unit. So I've spent a lot of my time in my nursing career just getting to know these patients in their acute stages of their relapses and withdrawals. So it was my prerogative to discover what kind of a treatment is effective and appropriate for these patients suffering from addiction. And that was my number one priority there. Population served is Freedom Detox serves the Carolinas, local to Gastonia and Charlotte, North Carolina. They are a drug and alcohol detox facility. They don't take minors, so anywhere from 18 years old and up. And this population is all from all walks of life. So to understand the needs of this population, I think, is to sympathize with their stories and their backgrounds. Many of these patients have suffered from oftentimes mental illnesses, to emotional abuse, to physical abuse. For the needs for them, they just want to be able to have access to safe detox through medical management, education with coping mechanisms for their withdrawal and their overall mental health, one-to-one professional psychiatric counseling, as well as peer support through group therapy, and then also long-term care plan and having a care plan through the case management department at Freedom Detox is really key to a lot of these patients' recovery and making sure that they have a plan after detox. These are the amenities at Freedom Detox, so meeting their needs, medically monitored detoxification, medication consultations with physicians or physician assistants, and also nurse practitioners. That is the in-house support, also counseling through psychiatrists as well as certified counselors, and then the case management side, again, the continuity of care referrals. I want to go over some of the social issues that they experience as far as a population goes, access to unbiased medical care, homelessness, criminal involvement, as well as family and caregiver support. So many of these residents have told me that they feel they don't seek medical help because they feel like they are being judged for their IV drug use or their alcohol abuse. A lot of them can't hold a 9-to-5 job, so they feel because of their lack of sobriety, so they end up living on the streets. They aren't able to afford rent or a home. They often are using illicit drugs like heroin, so oftentimes they get arrested for either making a living off, supplying drugs or using illicit drugs, and then also their lack of family and caregiver support. And many of them reported burning bridges, burning, relationships, and having unhealthy connections, and family, losing family in their lives. My role in this has been to help destigmatize healthcare providers by showing them that we are just people, and we're just people here that have experienced, mental health issues and illnesses in our own families, and in substance abuse in our own families as well. So I hope that I was able to destigmatize those types of feelings with those residents that were there, and then also, as Freedom Detox, they help also place some of these patients into sober living facilities to help have at least a temporary spot for them when they leave the detox center. Some of the political issues: legalization of medical marijuana for alternatives for pain, and lack of drug and alcohol facilities. I feel that the role of the healthcare professional, we as nurses, can help lobby for legalizing medical marijuana to create alternatives for pain, so as to decrease the heroin or the opiate epidemic, and help create another an alternative for pain, but their need to turn to IV drug use or alcohol. Lack of drug and detox facilities. I feel like nurses should be able to lobby for this need, this imperative need, because of this epidemic. This is important to for this country, because there is not a lot of these facilities and the need is increasing every day. So to lobby at a state and federal level is important definitely for healthcare professionals and nurses. Some of their economic issues: income inequality, urban-rural divide, and access to resources, and then unemployment. A lot of these patients feel that they were doing work and it was not commensurate with their pay, because there is a bias out there in the public with IV drug use or alcoholics. There is also an urban-rural divide as far as there being less access to these, even less access to these resources in the rural environment. But it does not mean that the need is not there. Also, I talked about unemployment, and a lot of these residents were talking about just how they can't hold the 9-to-5 job. So through my role with Freedom Detox, I was able to connect with these residents and hook them up with case management to apply for Medicare or Medicaid. We also got 2 of these residents referrals at the Department of Labor to help them find some more permanent work. Some cultural issues: homeopathic remedies used in religions or used in religious rites, civic constraints on alcohol, limited access to prescription drugs, limited access to prescription drugs, and then this leads to abuse to alcohol or illicit IV drug use. Binge drinking and drinking games in the U.S. is definitely one of the cultural issues that we experience that can lead to alcohol addiction. The homeopathic remedies: there was actually a Native American at Freedom Detox that he talked about accepted drug use in his culture, such as peyote, that is used in many religious rites. Civic constraints on alcohol: in the U.S. it's 21 years of age, but in other countries it's perfectly acceptable at 15 as a teenager to be consuming alcohol, perpetuating a lot of these alcohol addictions. There's also limited access to health insurance, health care, and obviously prescription drugs. So a lot of these patients and residents will turn to alcohol or illicit drug use because it's cheaper to get. And then we talked about the binge drinking. Project design. So I obviously, through my love of advocating for this population and my passion for mental health, I actually contacted the owner of Freedom Detox, and we talked about my experiences through the emergency department and through ICU. She put me into contact with the nurse manager. From there, I set up an appointment to meet with her and view their facility. We went through some of my objectives in inserting myself as an RN, doing some clinical hours there, and we were able to talk about their needs as far as me contributing my time there. So from there, we were able to make some connection as far as experience on both sides of the spectrum, whether it be outpatient or inpatient or through the emergency department. We have had a lot of shared experiences, and I thought this was pretty valuable here. These were just some project revisions for the future. I thought that coordinating a referral program with local emergency departments was especially helpful for some of these detox programs, getting them over the acute phase and keeping them getting them medically cleared before that they would come to these detox programs was obviously imperative, but just having a resource there in the emergency department would be very helpful for this population. And then second here, creating a relationship with local nursing schools for a 1-week clinical rotation. I think this is so imperative to bring awareness to new nurses and just break down those barriers with this population so that they feel like, yes, we care, we want to be more involved, and we want to help you with your recovery, but also with the nurses, that to help them realize that this is a real epidemic, and this is the need for these detox centers are so important. These are a couple of my objectives. By the end of this project, the learner will identify 3 inpatient interventions that will guide and aid the patient on a successful path to recovery. Number 1, providing a safe environment to detox through medical management. Number 2, help with anxiety and symptom control through medications. And 3, continued plan of care with a follow-up after a detox. I thought these were crucial interventions to help these patients on a path of recovery. Number 2, by the end of the service learning project, the learner will discuss 5 advantages of having more detox facilities in the state of North Carolina. And I said safely monitored and medically managed with medications because of the withdrawal symptoms, and they're less likely to use if their symptoms are controlled. They received physical assessments from doctors and mid-level practitioners. Most major insurances are accepted by Freedom Detox, and a lot of these are state and federally funded, a lot of these detox programs nowadays. Also, there are case managers on board to help with long-term care and follow-up, and then also just the general care of receiving one-to-one counseling and group therapy by professionals was crucial for these residents as well. Objective 3, by the end of the project, the learner will provide 3 teaching points regarding long-term drug and alcohol recovery to be used for patient education. So I decided that first and foremost, ask for help. Reaching out is the first path, to recovery. 2, mental illness and drug addiction are chronic diseases. Treat them like it. Keep taking medications. Keep up with therapy. And 3, support groups and group therapy like Alcoholics Anonymous help really emotionally manage your feelings and help create healthy connections with others. This is my impact, I feel, on the population. I helped to build relations with these patients and help decrease their stigma with RNs or help with the medical community, and to help really give them awareness of our role in their path, either in inpatient or outpatient setting. Also helping them to recognize signs and symptoms of their withdrawal so they can really try and control that before they try and use again. My personal reflection, I felt that I have a better idea of what they need on the inpatient and outpatient setting. I feel like I connected with them on a personal level and explaining to them that we are all people and we all have substance abuse or mental illness in a lot of our families. And then again, just destigmatizing the mental health and drug addiction in general has been really instrumental for my growth as a registered nurse as well, and just being able to understand where these patients are coming from and trying to meet them at that level. And lastly, my professional impact, it has enhanced my physical assessment skills. Obviously, my attitude is a lot more strengthened towards mental health in their acute phases of drug addiction. I advocate for referrals for these types of programs now in the emergency department, and now I feel like I am able to have more of an opinion and the confidence in lobbying for access to care for these detox facilities and drug rehabilitations in general. This is the conclusion of my presentation, and here are my references, and thank you very much.